Assalamualaikum and good morning to respective panels for this presentation. First and foremost, I would like to introduce myself. My name is Jawidah Raihan and alongside me is my partner Aisyah Azeman. We are 4th year dental students from UITM. I would like to begin by expressing our gratitude to our supervisors, Dr. Nurul Izzah Muhammad Sarmin, Dr. Hasnah Begum Gulam and Dr. Marlena Kamaruzaman for their guidance throughout this research. Aisyah and I would like to present our research entitled Evaluating the Association of Salivary Parameters and Dental Caries Assessment among Year 1 dental students in UITM Sungai Buloh.
Dental caries, commonly known as tooth decay, is an oral disease with the progressive destruction of teeth by bacteria acting on sugars and other fermentable carbohydrates on the tooth surfaces. Although preventable, it is one of the most chronic infectious diseases among children and adults and remain one of the common diseases throughout the world. It is affected due to host factor, diet, time, and presence of microorganisms. In this research, we study the association between salivary parameters and the decay missing filled teeth DMFT index to conduct a caries prevalence. Saliva is a fluid that surrounds the oral tissue and is derived from the major and minor salivary glands. The human saliva is involved in diluting, clearing, neutralizing, and buffering acids on the tooth surface. The DMFT index is a standard method to evaluate dental caries as it is simple, clear, and objective in addition to high validity, reliability, acceptable, sensitivity, and specificity, which are the crucial terms that we help dentists to understand how oral disease data is measured and presented. Last but not least, the caries risk assessment is an evidence-based approach for preventing, reversing, and, when necessary, repairing early damage to teeth tissue. Caries risk assessment still has a great potential to increase patient care and allow for a minimal invasive care plan. From this assessment, we can determine of the appropriate intervention and strategies for our patient. The aim of this study was to analyze the association of volume, flow rate, and pH in unstimulated saliva and stimulated saliva towards the risk of dental caries in first year UITM dental students. Now, I will move on to the methodology. Our sample size was calculated based on EpiInfo application. 69 out of 82 first year UITM dental students were selected as subject using convenient sampling method. For dental examination, subjects' dental record were assessed during the DMFT index. The data were collected in UITM Integrated Dental Record Management that we call IDEM.
Our next methodology is the collection of saliva sample. Prior to saliva collection, we instructed the subjects with proper guidance on how to perform saliva collection. The salivary parameters measured were volume, flow rate, and pH. All procedures were done following the protocol provided by the manufacturer of the saliva test kit, which is a GC Aisyah Dental. During the collection of unstimulated saliva, the subject was required to sit quietly with the head bent down to allow the saliva to pool on the floor of the mouth. Unstimulated saliva was collected in 5 minutes duration, where every 1 minute saliva was pooled and spitted in a sterilized graduated collection tube. For pH measurement, the pH indicator strip was dipped into the tube containing the resting saliva, and the pH was red in color coding, either green, yellow, or red. Meanwhile, during collection of stimulated saliva, subjects were required to chew paraffin wax for 5 minutes. Measurements of volume, flow rate, and pH were similar to unstimulated saliva procedures. Then, we used SPSS version 26 for data recording and analysis. Firstly, an independent sample t-test was used to compare the mean of unstimulated saliva and stimulated saliva parameters. Secondly, Pearson's correlation coefficient test was performed separately for unstimulated saliva and stimulated saliva to study the association between salivary parameters and DMFT. Finally, the calculation of DMFT and caries prevalence rates of first year UITM dental students were computed in Microsoft Excel database. From here on, I am going to discuss our findings from this research. In the table below, it shows the result of independent sample t-test for the mean of salivary parameters between two groups of saliva. The result displayed a significant difference with a p-value equals to 0 for volume, flow rate, and pH. Therefore, we reject the null hypothesis that there was no difference in salivary volume, flow rate, and pH between stimulated saliva and unstimulated saliva. The concentration of low saliva production in stimulated saliva is when the sum is less than 5 ml and is considered normal if more than 5 ml, quoted in the study by Rahiotis. From our result, we obtained the mean volume of unstimulated saliva and stimulated saliva of 2.43 and 7.94 respectively. Hence, the numbers are still within the normal range. Moreover, according to Cruz in 2013, the normal flow rate ranges from 0.25 to 0.35 ml per minute for unstimulated saliva and 1 to 3 ml per minute for stimulated saliva. We obtained the mean flow rate for unstimulated saliva of 0.45 ml per minute and 1.80 ml per minute for stimulated saliva. Thus, it showed that the mean for unstimulated saliva was slightly higher than the average value. Furthermore, a study done by Farsi in 2007 stated that the optimum range for pH was 6.6 for unstimulated saliva and 7.4 for stimulated saliva. Our result exhibited the mean pH 7.21 and 7.48 in unstimulated saliva and stimulated saliva. Farsi also expressed that the higher the physical pH, the higher the flow rate. Next, the result from our Pearson test showed no statistically significant correlation in all variables for both unstimulated saliva and stimulated saliva with p-value more than 0.05. To answer our main objective, it clearly shows that the increase or decrease in each salivary parameter did not significantly relate to the increase or decrease of the DMFT index. This statement is supported by the study done by Rahiotis et al., where he proclaimed that the absence of association is because the etiologies of dental caries are multifactorial. There are other proven causes that can lead to dental caries such as diet and oral hygiene. In addition, the result from Microsoft Excel database showed that the frequency of subjects with decay, missing, and failed teeth were 47, 5, and 35 respectively. The calculation for dental caries prevalence in first-year dental students was significant because these students were described as an individual with satisfactory dental status and bear a thorough knowledge regarding the causes and how to prevent dental caries. However, subjects with dental caries was calculated to be 68.12%, with only 31.88% only were caries-free. Our finding is almost similar to a study done on undergraduate dental students in Holy Karbala era, with 69.9% of their total samples were found to have dental caries, while the remaining 30.1% were caries-free. An important take-home note is that information alone is not sufficient unless these students embrace the knowledge they have and put an effort into it. From our findings, we recommend future researchers to involve subjects from different faculty. Secondly, involve final year dental students and compare the result with first year dental students. Thirdly, increase the sample size to increase the probability of successful outcome. Fourth, investigate other salivary parameters, for example, buffering capacity, and include plaque score count. Finally, use Caries risk assessment CRA form to further study subjects' diet and oral hygiene.
In conclusion, this study found no correlation between salivary flow rate, pH, and volume levels in first-year dental students with the MFT. In general, the salivary parameter did not influence the dental caries experience. Thus, the result of this study suggests that the level of these salivary parameters might not be used as indicator of the state of caries in dental students. However, dental health professionals have an important role in the improvement of the public health education level. For this reason, the acquisition of knowledge and attitudes relating to dental health and the prevention, control and treatment of dental problems during the future dentist training period is very important.
These are our references for this research presentation.
With
that, thank you.